A troubling reality is unfolding in Western Jamaica, where rising breast cancer cases are being met with limited access to life-saving screening and imaging. One survivor, now turned advocate, is leading the push for urgent change in Westmoreland. Sandy Williams reports.
In Westmoreland, the fight against breast cancer is being waged with determination, but without the full medical arsenal needed to win. Breast cancer survivor Marilyn Williams says women across the western region are facing dangerous barriers to early detection.
There's no mammogram machine in Hanover. There's no mammogram machine until you get all the way to Mandeville. And there's right now our easiest one in Hospitin in Montego Bay is inoperable. Yet Westmoreland has the highest incidence of breast cancer in the entire country of Jamaica.
Ms. Williams, who describes herself as both a survivor and someone living with an incurable form of the disease, is now on a mission to spare others the same fate. She says the Savannah Lamar General Hospital has never had its own mammogram machine, forcing patients into the private system.
When you go to SAF for the hospital, you have to go to Royal, to the private hospital, to get different various tests done like x-rays, etc. And actually Royal's mammogram machine is broken, has been broken, and when we asked them about when it was going to be fixed, they had no answer.
The result, she says, is delayed diagnosis and missed screenings, particularly among women who are already hesitant about preventative care. While routine mammograms are generally recommended for women 40 years and older, Ms. Williams notes that Westmoreland is seeing too many younger patients.
So we've got a double whammy problem here in Westmoreland. And they're not getting screened, they're not doing their breast self-exams by and large. And it's just by the time they find out they have the breast cancer, it's way too advanced.
At Savannah Lamar General Hospital, the clinical team is also feeling the strain.
Jamaica is burdened by things like breast cancer, prostate cancer, colon cancer, gastric cancer, and it is the general surgery team that deal with those patients here.
General Surgeon Dr. Lincoln Cox says the hospital's diagnostic capacity remains limited to basic imaging.
We have x-rays, we have limited ultrasound, but when it comes on to really managing cancer patients, what we need is a CT scanner or a magnetic resonance imaging, MRIs.
Without those tools, patients are routinely sent to private facilities in Westmoreland and Montego Bay, often at costs many simply cannot manage.
So patients will be sent for a CT scan. They can't afford it. It's 40,000, 50,000, 60,000. They don't come back. They don't turn up. They don't return. So it looks like the patient will abscond from care, but what happens is that they cannot afford to continue care.
Ms. Williams and her group of supporters are now lobbying both government and overseas partners to help bring a mammogram machine to Westmoreland, along with proper housing and operational support. They also want a strong public education push to change people's attitude to screening.
My mission before I leave here is to try to see to it that this doesn't happen to another woman.
Sandy Williams, TVJ News.